Hello, I'm Dr. Rajesh Khanna. Welcome to Medical Magic on First Run TV. In this episode, we are going to explore one of the most exciting emerging areas of medicine, stem cells. Stem cells are remarkable because they have the ability to multiply into other types of cells with specialized functions. There is great hope that the use of stem cells may provide new treatments for diseases and injuries. Join us now as we meet Dr. Marc Darrow of the Darrow Stem Cell Institute in Brentwood, California. Dr. Darrow is a recognized leading expert in the use of stem cell therapy as an alternative to surgery. Good morning, Dr. Darrow. How are you?
Nice to meet you, Dr. Khan. It's my pleasure.
Same here. So are you going to enlighten us about stem cells and tell us how it's going to benefit our viewers?
Well, I'm not an enlightener. I can just give you the information I have.
That's wonderful.
Which I think will make you happy.
So what are exactly stem cells?
Well, stem cells are cells that we find all over the body that are being produced every moment and released into our blood system. The ones that I use are from the bone marrow. We take it from the posterior superior iliac spine, which is above the buttocks. And it's a place in the bone that's thick enough to be able to put a needle into. And then the needle has a stylet, which is like a wire through the center. We can take that out and then we can administer a syringe to the needle and then aspirate very slowly the bone marrow.
So is it same thing like when we eat chicken and break the chicken bones, or eat lamb and break the bones? You see the brown stuff.
Well, I don't like to think about breaking bones because it's a very delicate procedure.
But it's the same stuff you see inside.
It's the same stuff. That's right. It's the bone marrow. And there's a plethora of bone marrow inside the pelvis. And it has mesenchymal stem cells, and it has hematopoietic stem cells, and these work very well in orthopedic medicine, which is what I do, the musculoskeletal system, which anywhere from the top of the head to the bottom of the feet, everything in between, the joints, tendons, ligaments, there's probably no place that I don't inject. And the reason for the injections with stem cells is to rejuvenate the body.
So these stem cells are just lying there. Normally, do they reproduce there, or they just dormant there?
No, they're not dormant. They're very active, and they are reproducing themselves logarithmically all the time. So
if something reproduces so fast, like in this room, it's going to fill up and burst the room. So how come it's not affecting the pelvis area?
It's like every homeostasis in the body. We have bleeding taking place all the time. We have clotting taking place. Not all those cells stay alive forever. So there's never a problem that we know of, unless it's a disease state with an overproduction. So the average person will come in for, let's say, a meniscal tear in the knee, rotator cuff tear in the shoulder, can be arthritis, can be very severe arthritis, what we call bone-on-bone arthritis. And it doesn't matter. These stem cells are placed in the area. It's a very short procedure. The whole thing from drawing the stem cells to injection is about 20 or 30 minutes. So it's a same-day procedure. Patient comes in. All we need to do is anesthetize the area just like we do when we do dental work. You know, it's lidocaine injection. It takes a second.
It's not painful once the injection is given?
It's not painful. We have patients come in and we mention stem cells and they go, well, I don't want to do that because I know someone that had a bone marrow transplant. And it was very painful. And I trained at UCLA with the bone marrow, and I saw hematologists and oncologists take a 60 cc syringe, chip into the bone, and then suction very quickly. And I've heard people say it feels like they're getting kicked in the buttocks by a mule or a horse. Very painful. What we do is different totally. We take a small amount, we don't need very much, and we aspirate very slowly so the pressure change inside the bone is minuscule. So people don't have a problem with that. Then after the spinning process, we just do an injection, just like with basic prolotherapy, which is proliferative therapy, which I've been doing for about 18 years.
And let's step back. When you say you take them out, are there different kinds of cells, or all cells are same? Because you mentioned mesenchymal and hematopoietic cells. So are there different kinds, and for different areas of the body, do you need to take?
No.
Various?
We don't need to worry about which stem cells they are. They work. And to be very honest with you, the way my brain works is not scientifically. I read science and I put it aside. I I read a lot of science. As a doctor, we have to. But science changes, as you know.
Right.
Being an ophthalmologist, you've done procedures that you don't do any longer, but at the time you did them, they were state of the art. Research studies are the same thing. They're state of the art today, and they're trash tomorrow. So what works for me in terms of treating patients is more of a healing model. What works? And that's what I do. I've done these procedures on myself. I do what works on me, and I bring it out to the public. I've done many different types of what you might call alternative medicine. I've tested myself first, then I bring it to my patients. What works for me generally works on other people.
That's good. So when you take out the cells, then you say spinning. What is exactly spinning, and what's the reason for doing that?
Well, let's talk about platelet-rich plasma first, if you don't mind.
Sure.
Because that was a progenitor of stem cell therapy. And a progenitor of that was using dextrose or zinc oxide, sodium moruate, other proliferants. Stem cells are really just souped up prolotherapy. What are we doing? We're stimulating the body to produce more tissue. We're made out of collagen. When collagen is lacking, let's say today I had a patient with a knee joint, actually bilateral, where you didn't see any cartilage. We looked, there's no cartilage there. A little bit maybe. The person was able to bend their knee, which means probably a little bit of cartilage. But on x-ray you couldn't see a joint space, so the doctors call that bone-on-bone arthritis. Is it really bone-on-bone? Not really.
Some
But
collagen might be still
to
there.
me, when a surgeon says that to a patient, it implants the patient with a disease state that cannot be fixed other than replacement of the joint. We don't have to replace joints anymore.
You mean without replacing joint, we can get them fixed again?
Yeah, and that's what regenerative medicine is about. All we do is we set up an inflammatory situation within the joint, tendon, ligament, wherever we inject. It can be anywhere in the body. It can be on the ribs. Sometimes people get their chest cracked for what we call a cabbage procedure, bypass.
Right.
And they'll have terrible pain, and we call that costochondritis. It means the areas between the ribs are inflamed. And we can inject there. We can inject TMJ. Dentists do surgery.
Right. And that's a very common problem. People have
I get a
TMJ.
lot of that. All we do is we inject into the temporomandibular joint. We can use dextrose, we can use platelets, we can use stem cells. But I sidetracked myself.
Right. We were talking about the spinning.
Centrifuge. So when we do platelet therapy, we'll just draw blood, like a lab draw when a patient goes to their doctor. It's like a lab draw. We'll draw a little bit of blood, we'll spin it. What we see then is from the centrifugal force and gravity, we place the test tubes in a cylindrical position like this in a centrifuge. And when we finish the 10-minute spin, and then we wait 5 minutes for it to settle, we take the test tube out. We'll see red cells on the bottom, which are heavier. We'll see the buffy coat in the middle, which has the platelets and white blood cells. And then we'll see plasma on the top, which is clear, maybe yellowish in color. And then we'll aspirate out that buffy coat. And then we'll put that in a syringe, mix it with some lidocaine, and inject it.
So it's not the cells we're injecting, it's that buffy coat,
The buffy coat has the cells. It has
the stem
platelets.
cells.
Well, when we do stem cells, you're right. Same thing. We'll end up with, similar to a platelet buffy coat, we'll end up with another buffy coat of stem cells. And then we'll aspirate that, put in a syringe, and inject that locally to wherever the area of disagreement with the person is, meaning that there's wear and tear, there's overuse, there's arthritis, there's a tear in the membrane. We see these things heal very efficaciously. The most efficacious thing that we have today that I know about is stem cells. The order of progression from using, let's say, dextrose or one of these other things that have been used for over 100 years is they're on the bottom in terms of healing. It works, but it ends up taking much longer and many more injections to do that.
So the first step was very interesting, spinning, just like in our exercise class, right?
Spinning.
And now we've injected the cells into the joint, let's say. What happens to these cells there?
Well, the cells multiply.
What stimulates them to start,
They just know
or that's
what
the
to do.
inherent?
That's what they do. Yeah, that's a whole science area that I don't delve into. But there is a lot of science on this. You can Google it, and it'll talk about what stem cells actually do. Again, I'm an empiricist. I'm not really concerned with how it works. I'm more concerned with what I do that makes the patient feel better.
So now when they go in there, do they differentiate into synovial fluid, cartilage, or just stem cells, remain more stem cells?
They're going to go where the problem is. And when we say, where is the problem, that's an enigma, really, because patients come in all the time, every day, and they say, I've got blah, blah, blah. I've got a meniscal tear. I've got an ACL rupture. You know, we're talking about a knee. I've got patellofemoral syndrome, worn cartilage. That doesn't mean that's where their pain is coming from. And this is something that I have to do in order to get the person to more of a healing mode. Because the consciousness is very important, I believe, with the patient's healing. If you get someone who's a grump, let's say someone who is a physicist, someone who is, let's say we get someone who's an analytical psychologist or psychiatrist, and they have to have things fit into certain parameters. They have more trouble healing, believe it or not, because they come in with something that's broken. They've been diagnosed as something that can't be healed. The mind has a lot to do with healing and the perception of pain.
Now, since you mentioned this, I'm just recollecting Kobe Bryant had to go to Germany to inject some stem cells in his knees at one time.
Kobe Bryant went to Germany. I don't want to pick him out, but it's...
No, I just remember reading from the newspaper.
Done prolifically in Germany, and it's called regenikine or orthokine. And these are procedures where blood is drawn, it's heated up, and it's processed to take proteins out that block interleukin-1, which is an inflammatory mediator. Now think about this, Doc. If you have someone who has a damaged area of their body, they have an anatomical challenge, are you going to want to take the pain away, or are you going to want to heal it?
Heal it. Attack the root cause.
That's right. And in the medicine that I'm trained in, obviously I went to UCLA, for my residency we're trained in traditional medicine, but that wasn't working for me. I didn't like that. Because what we did is we sent people to physical therapy, we gave them medications, we put the Band-Aids on them. When that didn't work, they went to surgery. I didn't like any of that. Part of the reason was I went through that. I had a shoulder injury, and eventually I had surgery. And I thought it would be very cool. I'm going to have surgery. The surgeries I was doing, I was going to have one on my shoulder. My arm blew up like a balloon. It was this big. I had a high fever, and I had traction blisters on my shoulder. I thought I was infected. I wasn't. What happened? I don't know what happened. Probably lymphatic vessels were cut and it leaked. It took about a year for that to settle down, and the pain was as bad or worse as before I had the surgery. So I started looking. I found prolotherapy at the time. This is a long time ago.
How many years are we talking?
I don't remember, about 20 years.
20 years.
And I injected my own shoulder one night, watching TV with my wife laying in bed, and she's using some expletives with me. She's using expletives. What are you doing? And I said, I'm trying something out.
But how did you come on this discovery to experiment?
Well, let me get there. Let me finish this one. I woke up the next morning, my shoulder was pain-free. That woke me up. Previous to that, I had been at a medical conference, and they were talking about prolotherapy, and they injected my wrist, which had been injured. 24 hours later, my wrist was 50% better. They injected it myself a few more times. It's been fine. So that's how I discovered it. And then I begged my patients, can I please try this new thing that worked on me? And everyone was like, yeah, I don't want surgery. Or I had surgery and it didn't work.
And since it's not a device or equipment, it doesn't have to go through FDA trials.
That's
or
right.
anything. All we have to do is some evidence-based medicine
right.
studies like you were mentioning.
Now the FDA is cautious about using fat stem cells. There's two requirements they have. One is minimally manipulated cells, and the other is homologous use. Minimally manipulated, what does that mean? It means that the cells don't have much done to them. So you can centrifuge them, and then you can re-inject them. Homologous use means it's coming from one area and going for the same purpose. So there's questions about using fat for stem
because
cells.
I heard some people take fat stem cells and inject under cheeks.
That's right, but that more is for cosmetic purposes, And it's not necessarily the stem cell usage for them.
So they
They
basically
don't mind, the
injecting
FDA
fat.
doesn't mind that as much.
Okay.
Yeah. They don't seem to have a problem with the bone marrow stem cells for some reason. I don't know who's running the show at the FDA or why they're deciding to do what they do.
What are some of the problems a person like me, if he gets injected, can face with the treatment like that?
Well, like any other injection, a person can have an infection from an injection. Anytime you open up the skin, you're opening up the immune system to attack. I've never had that happen, but it could happen. I've probably done about 15,000 patients over the years, and I get about 70, 80 new patients a month, so that adds up. And inflammation afterwards, that's part of the process. We are trying to inflame the area to stimulate the immune system to send cells to the area that actually produce collagen and cartilage. So fibroblasts.
So it's an indirect method of action.
Yes.
So that the stem cells go, cause inflammation, and the new cells which
That's
come
right.
in there, they lay down the collagen.
Well, it works both ways. The stem cells actually morph into the tissue. They become the tissue. They know how to do that.
And that's why we can't directly inject collagen itself, right? Like when
Well, people do
lips.
inject collagen, but it's not the answer because it's not going to morph into the tissue. It'll free float and then be absorbed.
How many times can this therapy done again on a knee? Let's say my knee, we inject once today. Do I have to come back every 6 weeks, or I'm done for life?
That is a question that I love that you answered, because we have people who come in and they've read about stem cells, the miracle of life, right? I'm going to live forever. Well, the problem is the people who come in and want to do it one time generally are not going to heal. They may get a little better. I have had healings with one session, but more often it has to be repeated. How often that is and what proliferant we use is up to the patient. I'm going to suggest, but oftentimes if someone has a very severe arthritis somewhere in the body, we're going to do at least a couple of stem cells and generally maybe 3 or 4 platelet therapy injections also. Can dextrose be used also? Absolutely. We can mix and match these things. They all work. It's just that the king of the hill right now is the stem cells.
Stem cell.
Yeah.
And is any of this covered by insurance?
Unfortunately, not at this time. The more that's done and the more orthopedic surgeons that do it, the more the insurance companies will be open to creating a diagnostic code. There is a diagnostic code for platelet therapy, but it's only a surgical code, so we can't use that for orthopedic medicine that's done percutaneously with a needle through the skin.
So how much would something like this roughly cost?
It depends on the person doing it. There are competitors that I have in Los Angeles that charge $15,000, $10,000, $8,000. I charge
Keep going down.
I charge $1,800 at this time, and the reason is because I want mom and pop to be able to have this procedure done. I think more than anyone else on the planet, because my prices are, reasonable as far as it goes.
Because that's only 9 times massage, right?
That's right. That's right.
So that means it's pretty affordable for the general public.
And I love my work. I want to be here till 8 or 10 at night. I love it. I would rather see twice as many patients as someone else.
Or are you still scared of your wife shouting at you?
No, my wife is wonderful. I have a beautiful wife who's a nurse practitioner, and what she does is something called the vampire facelift, which is taking platelets and injecting them into the face to create more collagen. It's a facelift without surgery. She also does it, not on me, but she does it on the head to stimulate more hair growth, and that works very well too.
Oh, that's very interesting.
Yeah.
Is there any other uses of the stem cells non-related to orthopedics?
Absolutely. Many, many years ago, I've always been experimental thinking in medicine and science. I went to the Bahamas and I had stem cells injected in my veins just for anti-aging purposes. I did that twice. I don't think it was a great idea looking back. It was embryonic stem cells from supposedly babies, fetuses from Eastern Europe. Morally, I'm not so sure anymore that's a correct thing to do. Legally, you cannot do that in this country, supposedly. I know doctors who do it. I think the best way to do stem cells for other purposes is do it through a research facility, university, where they actually can develop a line of stem cells. And I learned about this a long time ago, because I've always been interested in stem cells. It was a study, I believe, at Harvard, where they took rats that had retinal damage, and they developed a line of stem cells, and they injected them, and they went right to the retina, and supposedly the rats could see again.
See again.
Yeah, I wasn't there, so I don't know.
Well, let me ask, it's very interesting. You injected these cells inside your own bloodstream.
I did.
Is that why you look so young now?
I'm only 20 years old.
So it's not a risk to inject cells directly into your blood?
I think
and
it
get
is a risk.
reaction
I was
or
willing to
something?
take the risk. I've risked many things medically on myself, and I did a lot of things in medicine that people weren't doing at the time that are now coming to the forefront. I was the quack of medicine in my early days. Today, people come here from all over the world to study with me.
So you were like the early entrepreneur, lead researcher
I
into
wouldn't say
this?
entrepreneur. I'd say I was an early doctor scientist looking for cures for things that traditional medicine didn't have. And now I teach this at UCLA.
So wouldn't this save insurance industry a lot of money in preventing knee transplants? and ACL?
Billions of dollars would be saved,
And
and
so
will
what's
be.
preventing them for adopting this? What are the
Do you want to
road
get
barriers?
into politics?
No, just the road barriers. So a person who's watching this, then when he goes to his doctors, what kind of road blockades they might propose to him to prevent coming to this kind of therapy?
Well, at this point in traditional medicine, surgery is the king. That's what we all grew up with. That's what you grew up with. That's what I grew up with. That's what I studied. I always wanted to be a surgeon. And I love doing surgery. It's fun. The problem is this, in a nutshell. We have the pharmaceutical companies that run the show, and we have insurance companies that run the show. So who is it that gives information to insurance companies about what they should pay for in orthopedic medicine?
The surgeons.
The surgeons.
But has anyone done, like, let's say one knee, inject the stem cells, other knee, do the surgery and see how the patient turns out?
It's very difficult to do good science on this stuff because in real science you need to eliminate variables.
Mask the patient, but it's difficult to mask with these kind of
How do you
things.
do that? It's been done to some degree. I mean, there's been studies on knee arthroscopy versus fake surgeries. Guess who does better?
The fake surgery.
Yeah,
That's interesting.
yeah. So
You feel the placebo effect is built into
well,
surgery
you see,
of this?
placebo effect, according to doctors, is terrible. It's quackery. To me, I'd rather give you a placebo if I could. Why is that?
Prevent side effects.
No side effects. That's right. I've had many doctors work with me who give me placebos. The placebo can be a warm hand on my shoulder saying, you're fine. I think, the bedside manner that I think you have, knowing you for the few minutes I do, with your gentle personality and mine, are what do the healing.
I agree with you.
I truly believe that.
Do any of the kings come to you for this treatment?
I'm not allowed to say.
The kings mean orthopedic surgeons.
Oh, of course. I get all kinds of doctors that come here. I actually worked with an orthopedic surgeon in this office for about 10 years. And he tore his ACL one time. He fell off his motorcycle. And he used to send me about 15 patients a month for prolotherapy in the old days. And I said, don't you think this is wonderful? And he goes, no, it's placebo. And I said, well, is that a problem? He goes, no, if it works, it's fine. So he ruptured his ACL, he had knee pain, and he loved to ski. Ski season was coming, and I said, you're still having pain, can I do prolotherapy on you? Let's do an experiment. He goes, no, I don't believe in it. And I said, let's try it. I did it twice. I think it was a week apart. He went skiing, and I said, how was the snow? He said, best skiing I've ever had. I said, how about that knee pain? He said, no, my knee finally healed. How did it heal in 2 weeks, 3 weeks? When it hadn't healed in months and months
So
and
it's
months.
probably how I would like to tell our viewers, like acupuncture or acupressure. there was a lot of disbelief in those kind of therapies because it was so simple to perform. And I think that was what nobody believed it can heal. And I remember I also had shoulder problem once. I could barely lift my hand, and the acupuncturist was in the hospital that day, and she told me to lie down. When I looked up in the mirror, my whole body was half red, half white, if it can be as white as I am, and all needles sticking out. But the pain, it was gone. So nobody is yet able to explain why it works. So,
no, people can explain why it works.
but
Just that's not believed.
believed, right?
in
Same way, I
scientific
think
circles.
stem cells, you're saying works, and it's worth a try. Surgeons are trying it. The harmful effects are very less. So if somebody around the world is having problem, and especially sometimes you have a high blood pressure, other situations where you cannot go in for surgery.
That's true.
I have a cousin who suffered from Down syndrome and had this knee problem, and they wouldn't take her up for surgery. Now, if some person like that can benefit with such a simple treatment and made to walk again, I think it'll be a miracle, right? And
That's
I
right.
think there is less controversy if we recommend it for people who can't have surgery and then go on for people who could have had surgery.
Well, the nice thing is, to me, the law of medicine is do no harm. That means we do the most conservative thing first. And I always tell my patients, if you want to be conservative, don't go see a doctor. Go find a way to fix it first. Because we have iatrogenic problems, meaning the
Right.
doctors are causing a lot of problems for people. I don't mean to put medicine down, but I mean that's just the way it is. We know that. So do the most conservative first.
So I understand what you're saying. Do like self-healing, positive thinking first, like stretching exercises, building your muscle, then go for stem cell therapy. And if that doesn't work, you can always go to surgery.
You can always go to surgery unless, I always tell people if it's an emergency, go right to the surgeon. Get that fixed.
And doing this therapy does not cause any difficulties during the surgery?
No, not at all.
See,
Matter of
that's good
fact,
to-
I have had people who have stopped the program. My doctor says it can't work. And maybe they had 2 treatments. I'm going to talk about stem cells. But the earlier days with dextrose prolotherapy. And the doctor will talk them into getting surgery. And when they open them up, they go, I can't believe this. There's more cartilage growing here than we saw. So we know it works. I've got photographs before and after of x-rays showing cartilage growth. We know it works. We have biopsies that we've done. We know it works.
Can the volume of collagen be determined before and after the treatment?
Yes.
And how do you determine that?
Well, if you look at a knee joint with, let's say the medial joint is compressed because there's no cartilage. So you can see, on an x-ray you'll see black for cartilage, and the other side you'll just see the white bones. And then after several treatments you can see actual cartilage filled into the area and the bones separated.
That's very interesting.
Also, there are times when I've had patients, like young athletes from UCLA that come here, rotator cuff tears, lateral epicondylitis, tennis elbow tears in the extensor tendons. We do the procedures, they go back, they can't do their sport until they see the orthopedic surgeon. He goes, I can't believe it healed. I've never seen one heal before. They don't go, wow, that's amazing that this procedure healed it. It's still in the mind, it can't work.
So people just have a sense of a mental blockade or disbelief that something so simple, so innovative is working better than the traditional medicine, and that's why there is hesitation in adopting it.
Absolutely. Let's talk truth here. Medicine is a religion. And there's different religions within medicine. And if you're raised in a religion, that's what you believe. And only your religion is the good one.
Oh, that's a lot of philosophical thought.
Now, that's
right
the truth.
there.
I'm open to all religions. Religions are man-made. Spirit is from God.
I agree with you, because that's like when people said heliocentric theory, that the Earth is the center first, geocentric,
Of
and
course.
then we said, no, the sun is. They wanted to burn out the guy who said Earth is the center, right? And so now we know the truth, or do we really know the truth?
Who knows? Maybe it'll change again.
Now they're saying not the sun, but the Milky Way has a different center, and we're all revolving around that. So I think we have to keep an open mind. After you see this show, do your own research on Google, as the good doctor was saying in the beginning, and definitely consult with your own doctor before embarking on any therapy. But I think from what we've learned today about stem cells, it's something anybody suffering from any pain, joint pain, should try.
It may not be the first thing we try, but for the difficult cases we use it.
Thank you so much, Dr.
It's
Darrow,
my
for
pleasure.
spending time with us.
Thank you, Dr.
All right.
Marc.
Thank you for joining us on Medical Magic here on First Run TV. We'll continue to bring you intriguing insight into the newest breakthroughs in medicine. I'm Dr. Rajesh Khanna. See you next time.